Finally, let us draw a transverse section of the pelvis. And here you have the sacral promontory, and you see this medial border of the pelvis like this, which goes on to the symphysis pubis. So if you want to make the sacrum, you will have this body of the sacrum, the neural canal, the two ala of the sacrum, and here will be its spinous process. On this side, you will have the iliac crest, and then you will have the anteroesophageal spine, the anterophilic spine, the pectineal eminence, the notch for the artery, vein, and nerve, the pubic tubercle, and the pubic crest. Let us make it on this side: the iliac crest, the anteroesophageal spine, the anterophilic spine, the pectineal eminence, the notch for the artery, vein, and nerve, the pubic tubercle, and the pubic crest. From this portion, you will have the head of the femur, the neck of the femur, and you will see the trochanter, and this will be your acetabulum. So here will be the inguinal ligament, and here will be the lacunar part of the ligament. Here will be that famous obturator artery, corona mortis. Then you will have the pectineus muscle here. Then you will have the psoas emerging from this, and the iliacus emerging from this, and from the anterior inferior iliac spine you will find the straight head of rectus femoris, and from the anterior superior you will find the sartorius. So these are the anterior structures, and if you want to approach a fracture which is in the pectineal eminence here, the anterior column fractures in the pectineal eminence, then you have to remove the sartorius, go under the iliacus, remove the straight head of rectus femoris, go under the psoas, and reach up to the pectineal eminence. You do not cross the pectineal eminence, because here will be the nerve, the artery and the vein, the lymph node of Clockway, and this. So from the lateral side you approach till pectineal eminence. Medial side you take off the ligament or the pubic tubercle, lift it up, ligate corona mortis on both sides, and then you slide a plate under the artery, vein, and nerve. So this side of the plate is here, and this side of the plate is here, and you are able to fix this fracture which is passing through the pectineal eminence, which is the anterior column fracture. So then after this you will have the tensor fascial artery here. So you can go between the sartorius and tensor fascial artery and approach the hip. This is called as the Smith-Peterson approach. You can also approach the hip from the anterior side, the anterior approach. Then you can go behind the tensor fascial artery, which is called as the Kevin Harding approach. Then you can split the gluteus medius or do a trochanteric, and from the posterior side you will have the piriformis superior gemellus inferior gemellus plane here, the capsule and the obturator externus here getting inserted into the trochanteric fossa, and the max plane here. So posterior is go through the max, go through the piriformis superior gemellus, inferior gemellus, obturator internus plane,